You get to pick where you want to have your fat removed during a liposuction procedure. You can show me the areas that concern you. Despite diet and exercise, you can't tell your body to take fat away from a certain spot. But with liposuction, you can pick exactly the spot you want the fat removed. We can also reuse that fat and revolumize an area that has lost fat and doesn't have the shape that it once had. Traditional lipo was an older technique that used large cannulas the size of my finger. We would have to insert those through larger incisions and manually grate the skin to remove the fat. That was very painful for patients and took a prolonged time to recover and had higher blood loss. It was 50% blood, 50% fat in those early days, and we were limited to removing just 1 liter. With more advanced power suction-assisted lipectomy that we're performing today, we're using a tumescent technique where we infiltrate the body with numbing solution to blow the fat cells up to be big targets. That's what you want, kind of like at the carnival game where they have those balloons and you're throwing the pin at it. You want those balloons to be giant and the spaces in between that have the blood vessels to be small. This way, we're able to pull out 99% fat and only 1% blood. The machine is power-driven and vibrating, so it invigorates and reduces the fat and removes it more smoothly and effectively, and also more evenly than the traditional cheese grating liposuction of days old. With the advanced machinery, we're able to achieve better results and quicker recovery because it's gentler on your body. So for achieving a natural contoured look with liposuction, it's important to preoperatively plan. And again, in the consultation, I'll simulate for you on your body what the area is expected to look like so you can see what your new contour can look like when we're all done. Having that visual gives you the best idea of your realistic expected result. The liposuction is a once-in-a-lifetime procedure. Once I'm able to remove those fat cells, they're permanently gone. As long as you're able to maintain your body weight and not gain excessive weight, your results will last forever. Unfortunately, some patients do have weight gain and changes afterwards. If that happens, you're always welcome to come back to us. We can take another look and see what has changed and we can help you. Some people think that fat goes to other areas of your body after a liposuction procedure, but fat cells don't have legs. They don't move around. They're not able to go from one part of your body over to another. If an area does increase in size, we're able to address it and reduce it. Many patients struggle, whether it's they don't know what to do and where to begin, and we just want to reduce as much fat as we can, or some people are at the finish line where they've done all the dieting and exercise they can, but there are stubborn areas of fat that just will not come off despite how much they've done, and they don't want to lose any more weight and lose the volume in their breasts, in their buttocks, in their face, and look more aged. So all of those people are good candidates for the liposuction procedure. We take care to monitor your body's functions, vital functions throughout the procedure. We are very careful with the dosing of medications that we give you and careful with how much we're removing, following all the state guidelines so that we can achieve the liposuction result for you safely and effectively.